When you perform a spinal fusion, you want the best outcome for your patients. You want an easy, intuitive surgical technique and a cost-effective system. The role of the interbody fusion cage is to restore the natural height and lordosis of the motion segment and to stabilize until a solid bony fusion has occurred. Therefore, the cage system needs different footprint sizes in various heights and angles. This makes the system complex and requires a lot of inventory. But often, the ideal cage size cannot be used because the cage is too big to pass the narrow entrance into the intervertebral space. Expandable cages solve this problem by allowing you to put in an undersized implant and then expand it as needed. But all expandable cages available on the market only have one actuator. This means that they can only adjust the lordosis angle at a fixed height or adjust the cage height at a fixed lordosis angle. Some systems have combined movements and change height and angle simultaneously, but height and lordosis cannot be adjusted separately. As a result, there is a high risk of a point load as the cage is never perfectly adapted to the surface of the vertebral body. This increases the risk of end plate penetration or subsidence. BlueOceanSpine solves this problem by providing two actuators in their expandable cage systems. That allows for separate adjustments of segmental height and lordosis, so any possible combination of height and angle can be achieved. Independent adjustments of height and angle are possible. The surgeon can restore the patient's anatomy and achieve the best end plate contact. The patient undergoes an easier and faster minimally invasive procedure with a better outcome and lower risk of end plate penetration and subsidence. BlueOceanSpine's expandable cage systems consist of just a few size configurations, so complexity and cost of inventory is significantly reduced. In addition, 3D printing technology reduces manufacturing costs by minimum 50%. You get more for less. How could this technology improve your next fusion case?